situation there. Jens.
Yeah, thank you, Alessandra, and good morning, everyone. The humanitarian situation in and around Goma remains extremely worrying. And again this morning, our colleagues in the Democratic Republic of the Congo report heavy small arms fire and mortar fire across the city and the presence of many dead bodies in the streets. We have reports of rapes committed by fighters, looting of property, including of a humanitarian warehouse, and humanitarian and health facilities being hit. Hospitals in Goma are reportedly overwhelmed, struggling to manage the influx of wounded people. Electricity and water supplies are compromised, and yesterday internet services were cut off and Goma is still offline this morning. Since the flare-up of hostilities in the beginning of the year, hundreds of thousands of people have attempted to flee the violence, including the 700,000 people already displaced and living in dire conditions on the outskirts of Goma. On Friday, sites hosting at least 300,000 internally displaced people were completely emptied due to the rapid advancement of the front lines. Non-essential humanitarian staff have been relocated to reduce risks, but critical personnel remain in Goma. As you may have seen, the UN's emergency fund, the SURF, has immediately allocated $17 million to support the humanitarian response. The humanitarian coordinator in the DRC, Bruno Le Marquis, has called on all parties to agree on temporary humanitarian pauses in the most affected areas and establish humanitarian corridors to ensure humanitarian activities can resume at scale and facilitate the safe evacuation of wounded people and civilians trapped in combat zones. The humanitarian coordinator has also stressed that it is critical to ensure the safe reopening of the Goma airport and to keep the border posts between Rwanda and the DRC in Goma operational to enable people to flee the violence. Thank you.
Thank you very much, Jens. I'd like to give the floor online to Mats Salmash for UNHCR.
Thanks, Alessandra, and good morning, everyone. The humanitarian crisis in the DRC has further deteriorated since our last briefing to you on Friday, with now nearly 500,000 people displaced in North and South Kivu provinces in January alone. Hundreds of thousands have been forced to flee multiple active conflict zones, and the capacity to accommodate and assist them is now saturated. Many of those displaced have fled violent attacks, including the use of heavy artillery, targeting internally displaced people sites. These are spaces that are intended to provide safety and refuge. These attacks have destroyed shelters, essential infrastructure, and tragically claimed many lives. Several sites on the outskirts of Goma, as we heard from Jens Onocha, housing more than 300,000 people, were completely emptied within hours over the weekend, and 18 IDP sites around the city have been largely emptied as those who are displaced flee heavy artillery. We remain in the country and in the area, and we're ready to assist when the conditions will allow. The restricted access to the conflict zones is worsening conditions for millions of the displaced people. With our partners, UNHCR calls on all parties involved in the conflict to immediately respect international humanitarian law and to prioritize civilian protection. Our protection monitors are also closely following cross-border movements. We understand that many people are waiting to assess the situation before making further decisions. With our partners, we're ready to respond to any outflow of asylum seekers from the country, ensuring their protection and providing critical assistance to those in need. The humanitarian crisis in the DRC is not just a regional concern, but it's a global responsibility. The displaced Congolese people deserve an opportunity to live with safety, dignity, and hope. The international community must step up efforts to support affected populations and to facilitate long-term solutions to end this cycle of violence. Thank you.
Thank you very much, Mats. We have online Shali Thakral from Kinshasa. Good morning, Madam. Can you brief our journalists on the situation of food in Eastern DRC?
Thank you, Madam Speaker and colleagues. And may I also reiterate the worsening situation and growing humanitarian and protection needs that we're facing. A major surge in violence in the eastern region of DRC has led to hundreds of thousands of people fleeing multiple active conflict zones. WFP's priority is keeping staff and their dependents safe. Only critical WFP staff remain in the area, and once the security situation improves, we can resume our emergency assistance and operations. There are growing protection concerns as hundreds of thousands of people have been displaced in and around Goma. Many are exposed to gender-based violence and with limited access to food, safe, clean water, and income. The risks facing the populations, hour by hour, day by day, will only increase in these volatile conditions. We've seen families fleeing the fighting, and they're facing unimaginable challenges. Every step of their journey is fraught with danger. Roads are blocked, ports are closed, and those crossing Lake Kivu risk their lives in makeshift boats. Certain IDP sites have been emptied where fighting has been the most violent. I spoke just moments ago to an activist in Goma, and he told me, "We're here, we're hiding, we don't know who will come to help us." There's massive displacement of the population, including both new people and those who have been displaced multiple times. Even before this recent escalation in violence, some 5.1 million people in Ituri, North and South Kivu have been displaced and forced to live in overcrowded camps with little food and no security. Food assistance activities in and around Goma have been temporarily paused. WFP is concerned about food scarcity in Goma and rising food prices as the airport and major access roads within the region have been cut off. So depending on the duration of violence, the supply of food into the city could be severely hampered. This is a huge test for Congolese trapped by fighting in Goma and surrounding areas of their resilience, and the next 24 hours will be critical as people start to run low on supplies and will need to see what they can find to survive. WFP finally wants to reiterate that we strongly condemn the escalation of violence in the eastern DRC that's endangering these populations. We call on all parties to the conflict to immediately cease hostilities and uphold obligations under international humanitarian law, including the protection and safety of humanitarian workers.
Thank you very much, Mrs. Takral. I give the floor to Dr. Adelhaid Marchang. Madam, to hear about the health situation and consequences of the violence in this region. I don't have on my notes the place where you're talking from. If you could tell our journalist, and I give you the floor.
Thank you, Madam Chair. Good morning, good afternoon. I'm talking from Geneva, and I will speak with you today on the health implications of the violence in the Democratic Republic of the Congo in the eastern DRC around the city of Goma. Goma, previously a refuge for hundreds of thousands of displaced people, is now at the center of escalating conflict, further endangering lives. WHO Assistant Director General for Health Emergencies, Dr. Chikwe Ihekweazu, recently visited Goma to assess the humanitarian and mpox response. WHO has hubs in North and South Kivu in the cities of Goma and Bukavu, from where we respond, and will continue responding to the Eastern DRC's health needs. Before the airport at Goma closed this Saturday, WHO was able to send critical medical supplies for trauma and emergency care, infection prevention, cholera, and basic essential health needs. WHO is providing tents for hospitals to expand their treatment capacities and to cope with the increasing number of injured. Hospitals are overwhelmed. There are currently hundreds of people in hospital, most admitted with gunshot and shrapnel wounds. Secondary infections become a health risk. WHO is especially worried for the health and safety of women and girls who are at the higher risk of violence, including rape. Pregnant women are at risk with very high maternal death rates, even before this recent escalation of violence. Capacities to deal with the newly injured are stretched, and WHO is working with authorities and partners to identify solutions and to increase local capacities to deal with this. Sadly, hospitals and health workers are in danger too. We are hearing reports of health workers being shot at and patients, including babies, being caught in crossfire. WHO reminds everyone that attacks on healthcare violate the rules of war. Healthcare must be protected at all times. With people again on the move and infrastructure such as water stations and electricity grids damaged, the conditions are rife for the spread of infectious diseases like cholera and measles. And along with the physical toll, there is also the mental health toll of this emergency. While these risks grow, it also becomes much harder for people to get the health care they need, and their coping mechanisms are exhausted. Displacement happens over large distances. People get exhausted and desperate. Last year, North and South Kivu reported 21,672 cases and 59 deaths from cholera, and 11,710 cases and 115 deaths from measles. Malaria continues to be a major killer in the region. Eastern DRC is the epicenter of the outbreak of the new Mpox strain, which the WHO Director General declared of a public health emergency of international concern in August 2024, just a few months ago. Over 20,000 suspected cases of Mpox have been reported from North and South Kivu since 2024, including more than 6,000 in the last 6 weeks. Because of the violence, it's hard to properly track and treat the disease, even more so when people are constantly on the move. Over 1 in 4 people living in the region is facing emergency levels of food insecurity and risk of hunger, with many people malnourished and weak in the face of disease. WHO is looking at scaling up the response as much as possible in the current situation, while at the same time ensuring the safety of its staff. It is essential for WHO and other humanitarian partners on the ground to have safe and assured access to people in need. Thank you. Back over to you, Madam Chair.
Thank you very much. And last but definitely not least, on my right, Patrick Youssef, ICRC.
Thank you so much, Madam Chair. And sorry, we're quite all heartbroken because of we have to be back again here and talk about the blood and suffering in the east of DRC. In the past days, with a growing alarm, we have been following developments in Sudan and the eastern DRC. I'm sure many have seen the horrific images that emerged from Al Saudi Hospital in Sudan city of Al Fashir, where dozens of people were reportedly killed. During that same time in Goma, heavy shelling and shooting in densely populated areas have resulted in an influx of many hundreds of injured. More than 100 people within 24 hours arrived at Ndosho Hospital, where the ICRC surgical teams are working. We would normally receive this number of patients in 1 month. The influx is such that the hospital parking was transformed yesterday into a triage zone. Beds are lacking and patients are left without anything and waiting in corridors. And while the hospital is overwhelmed, we're still receiving calls from desperate injured people who struggle to access healthcare. Our teams, together with the hospital staff, have been treating people with mortar and shrapnel wounds, many of them with head wounds and chest traumas. Very disturbingly, we have seen a significant increase in the number of severely injured children. We've described what we see in two different conflicts in two different countries, but there is a very alarming common trend. Civilians are paying an increasingly heavy price for brutal armed conflicts, and this must stop. We urgently call on the parties to respect their obligations under the Geneva Conventions and do everything possible to spare civilians and civilian infrastructure. By the way, in both DRC and Sudan, we increasingly see the use of heavy artillery in populated areas, which compromise access to essential services like water, electricity, and healthcare. I remind you that the second worst displacement crisis in the world is in the DRC, and the first one is unfortunately in Sudan by all standards. To conclude, in DRC and Sudan, we continue our dialogue with the parties and insist they take immediate measures to protect civilians and critical civilian infrastructure. And unless the law is protected and respected, the human toll will continue to grow. Before entering the room, I just learned that our medical warehouse was looted in Goma, and unfortunately has to be now urgently and refurbished. That will obviously take time, but there's just one price that we have noticed ourselves compared to the thousands of heavy tolls taken by the civilians in Goma. Thank you.
Thank you very much, Patrick. And just to conclude, I just would like to remind you that we have distributed on Sunday the statement of the spokesperson for the Secretary General on the situation in DRC, and also yesterday the Security Council press statement on this situation. There is quite a lot of information there too. So, and before I open the floor to question, journalists are asking online, and I'm sure also in the room, that everybody sends their notes as soon as possible during the briefing, so that they can be sure that they report correctly. Okay, lots of questions. I've seen Yuri first. I will say to our colleagues who you are, as they don't all know you. Yuri Aprelev, RIA Novosti.
Bonjour, Monsieur Patrick Youssef. Je vais vous poser la question en français. Par rapport au staff du CICR que vous avez sur place, est-ce que vous comptez les laisser? Combien est-ce que vous en avez? And same question for OCHA, Jens. Do you know how many people you still have there? And because we heard about the fact that the UN is cutting back the non-essential staff, but how many people are still remaining there, and how many people were sent out from this area? Thank you.
Donc notre stratégie n'était pas d'évacuer qui que ce soit, bien au contraire, nous avons 19 staffs généralistes qui travaillent encore à Goma, ainsi en plus 14 staffs médicaux qui travaillent 24 heures à l'hôpital de Ndosho, à l'hôpital de référence à Goma également, ainsi que dans d'autres centres de santé. Donc le motto c'est de rester, c'est de travailler et c'est justement d'engager, comme nous l'avons fait depuis plusieurs mois, les parties au conflit en préparation à ce qui allait venir, et voilà ce qui s'est arrivé.
Yeah, thank you. As you know, often in these situations of armed conflict, we do not give specifics about our staff. I will ask if that is something we can tell you, because it is, of course, as we've heard from other colleagues now, a security issue also for those. What our point is that essential staff that are critical for program implementation are still in Goma. And they are the ones who will help, implement the programs that the 17 million from the SURF has now, that has been injected in the response, which is, as you know, very underfunded. Already. So those people are still there. The non-essentials have been relocated for their safety.
Maybe just to add to this, what Jean-Pierre Lacroix, our Undersecretary General for Peace Operations, said yesterday, and I quote him, "The mission has begun temporarily relocating its personnel and their dependents from Goma over the weekend by air and road. The process is ongoing with relocations continuing as he spoke." That was yesterday. Obviously, the safety and security of our personnel is and must be paramount, but parallel to that, of course, our colleagues at MONUSCO continue to deliver on their obligation to protect civilians to the best of their ability. And it's really important, I think, as Jens said, to say that whatever decisions are taken for the safety and security of our colleagues, the most important focus for us is the protection, really millions of civilians whose life and fate really are at risk at the moment. Lots of okay, small.
Just a quick follow-up, Jens. We have seen, especially in Sudan and in Gaza, the past years and in the past conflicts, that the UN staff are not under great protection, as it has to be the case. Have you seen any incidents with your staff in DRC? Thanks.
Thank you. I have not seen any reported incidents against OCHA staff, but that means what I said. It means that I have not seen any reports from that. It doesn't mean that it hasn't happened, but I have no indication that that's the case.
Emma Farge, Reuters.
Good morning. I was hoping that WHO might be able to give us an estimate of the death toll, maybe from hospitals, and maybe Jens could give us an idea of how many dead bodies have been seen. I'm wondering if you have any idea of the scale of this at this stage. Thank you. Or Patrick, thank you.
Thank you. I'll start with Dr. Marchand. Do you have any figure on the casualty, madam?
Thank you. We do not have any figures on the overall numbers of deaths. However, from contacts with all the hospitals that we have maintained as much as possible, and that was what we received as of Saturday morning, there were over 600 to 700 patients in beds in at least 4 to 5 hospitals that are taking in wounded patients. We will be able again to give an updated figure once communication is established, but that doesn't mean that on the ground they don't have that figure. So we are constantly in contact with hospitals looking at the gaps in equipment, in treatment capacity, and as highlighted, we have constantly and flexibly tried to allocate tents to increase bed capacity and treatment capacity, not just for the injured that have been overwhelming hospitals, but of course also for other ailments that are coming in at the same time, also looking at maintaining an overview over patients with infectious diseases and of course child illnesses. As we move forward, we are hoping to be able to allocate more supplies from what has already come in, as mentioned. We have made distribution plans, and as the streets and the security allows, we've heard that it was quite dire yesterday and even this morning. We are ready to dispatch more of these items. We are very concerned also about the issue of intra-facility, intra-hospital infectious prevention, so as to prevent secondary causes of deaths from wound infections or from other or from intra-hospital infectious disease transmission, and therefore very mindful to prevent infections at the hospital level, and had teams that were in contact with health workers to understand if there were any outstanding needs that we are covering as we move forward. Thank you.
Yeah, thank you. To Emma's question about if we know how many dead bodies are in the street, of course we don't. As I just mentioned this morning, we have reports of heavy small arms fire and mortar fire across the city. So for people's own safety, we don't walk around the streets and count. But I have no reason to doubt the reports that we get from our colleagues who are able to have a look out their windows, what they see in the street.
Just for housekeeping, I've got Jeremy, AFP, F. Gunilla, DPA, Beza. Lots of questions. Let's go ahead with Jeremy. Je te présente Jérémy Lange, Radio France Internationale.
Thank you, Alessandra. I think you all mentioned IDPs being attacked, patients if being shot at. I think that's what WHO said. And Patrick, you mentioned also like the shrapnel wounds and the mortar injuries. I'd like to understand all those IDPs, civilians being caught in the crossfire, like in the middle of the shootings, or are they being deliberately targeted from what you're seeing on the ground?
Who would like to start? Colleagues, when there are questions also where you feel you can contribute, just let me know. I'm start with those I can see, but also online from Kinshasa.
Patrick, vous pouvez répondre en français aussi, c'est
Ouais, non, parfait. Donc en fait, il y a forcément deux tendances. Un, on est devant une nouvelle situation, donc une poussée déjà sur les Minova et sur les régions avoisinantes. Et donc là, effectivement, il y avait beaucoup de crossfire. C'est ce qu'on apprend aussi à Goma. Les populations sont en fuite. Et effectivement, c'est ce que nous avons appris encore. Mais à mon avis, il est très prématuré d'avoir une réponse claire de pourquoi et comment. Donc, je pense que le shelling a été fait dans les quartiers résidentiels et c'est ce que nos équipes nous rapportent. C'est que comme d'ailleurs nos staffs résidents qui continuent à être à la maison, il se peut effectivement qu'il y ait un incident de sécurité de ce type avec des shellings, des bombardements qui résultent effectivement avec des morts ou des blessés. Et c'est ce qu'on reçoit de plus en plus à l'hôpital. Après, la source de l'attaque, il faut encore du temps pour effectivement avoir les bonnes analyses. Je vous rappelle juste que nos 3 équipes chirurgicales travaillent depuis 48 heures non-stop à l'hôpital et il est très difficile d'avoir toujours les rapports détaillés de leur travail.
I see we have Ravina online. She has raised her hand. Ravina, would you like to add something? Ravina Shamadasania, OHCHR.
Thank you, Alessandra. I just wanted to back up what colleagues are saying. We remain in the country as well. As you know, there's a joint human rights office that's a part of MONUSCO, and we have staff, across the country, including some staff in Goma at the moment. Colleagues pointed out the security situation for the UN. I also wanted to add that we are actually profoundly concerned for the situation of human rights defenders, civil society actors, and journalists in Goma. And we are reminding all parties to the conflict of their obligation to ensure the protection of civilians, including these people who are particularly at risk. Similar to what colleagues have conveyed, we're also hearing reports of heavy gunfire, urban combat, and the use of explosive weapons within populated areas. And once again, we remind all parties to the conflict of their obligations under international human rights law and international humanitarian law to ensure the protection of civilians.
Thank you very much for this addition, Ravina. As I said, colleague, please feel free to intervene. I've got Nina Larsson, AFP. The list. Pardon? Ça va pas du tout. Agnès Pedel, AFP. Mais c'est la même média, pas la même personne. Pardon, Agnès.
Pas de souci. Thanks all for your briefings. A follow-up to WFP and a question to ICRC on the suspension of, I don't know if WFP is still listening.
WFP, yeah, okay. Shell is online. Okay. Yeah.
Yes, on the suspension of food assistance in DRC, in Goma, specifically, if you could specify if it's only UN food assistance or all food assistance of any organizations. Et pour le CICR, concernant le pillage de votre entrepôt, est-ce que vous avez des détails sur les quantités de fournitures qui se trouvaient à l'intérieur? And other organizations, UN organizations, have you seen also any lootings of your warehouses? Thank you.
Start with Shelley.
Thank you so much. We have also a critical team on the ground who are just really there to ensure that, as soon as we can, as soon as safety permits, and these are just in areas which have been affected by the ongoing violence. We are still operating in other parts of North Kivu, South Kivu, where we can kind of get to people as safely as possible. In terms of looting, sadly, the situation has deteriorated, and to reiterate also on the human rights and also with ICRC, we are seeing some of our warehouses being looted. This is also just one warehouse in particular close to the airport. I mean, this is just goes to tell you how desperate, how desperate people are now in terms of, what it is they need and what we're really asking for in terms of a cessation of these, violent atrocities that are happening. There are stray bullets. They are, loose ammunition, which are getting into the hands of the wrong people, which if we don't contain quickly and as soon as possible, this will just, grow into a much larger crisis than it already is. Thank you.
Oui, merci. Donc, pour la question, en fait, nous venons de l'apprendre, mais nous savons aussi que c'était des générateurs, des airs conditionnés et aussi la réserve du stock médical. Ceci dit, ça fait depuis quelques jours que les équipes travaillent et utilisent justement ce contingent médical que nous avons à Goma. Et donc, je ne peux pas dire que c'est pas trop grave, mais c'est effectivement, c'est une réserve qui a déjà été bien utilisée et que le ravitaillement arrive depuis le Kenya, à voir si c'est à Bukavu, depuis directement à Goma. On va voir dans les quelques jours. Je vous rappelle aussi qu'il est très important de parler de deux choses. La première est dans le cadre effectivement de la protection de la mission médicale. Le CICR a fait donc des démarches et est encore très préoccupé par la situation au sein du laboratoire de l'Institut national de recherche biomédicale qui fait face à un risque de coupure d'électricité, ainsi que une question de préserver justement les échantillons qui peuvent être touchés par les affrontements et qui pourraient engendrer donc des conséquences inimaginables si les souches bactériologiques dont le virus Ebola qui l'abrite venaient à se répandre. Et du coup, c'est très important de ne pas juste se focaliser sur, bien sûr, il y a beaucoup de détresse et beaucoup d'appels de détresse, mais il y a aussi des facettes de notre action qui, oui, resteront toujours confidentielles et bilatérales, mais qu'on partage aujourd'hui au vu de l'urgence. Et donc, important de rappeler que le dialogue avec les parties, on est en contact permanent et régulier avec les parties au conflit pour effectivement maintenir ce dialogue prot et toucher à des sujets d'actualité et pas juste un rappel générique de ce que le droit nous leur accorde. Merci.
That's scary. Do you want to add anything? No, looking. Okay, so I go to the next question. Isabel Sacco, FA? No, it's good. So my next one is Gunilla von Hol, Svenska Dagenblatt.
Thanks for taking my question. I have two questions. Now, one is you mentioned gender-based violence. I think several of you, and rape. What information do you have? Is that who is behind that? Is it M23 or is it DRC soldiers? Second question is the Belgian foreign minister is accusing Rwanda of creating a catastrophic humanitarian situation. What is your comment to that? And are you concerned that donor countries would freeze aid to Rwanda that's allegedly is behind the M23 offensive? Thanks.
Who wants to start on gender-based violence? I'm looking at my colleagues online also. Ravina and Shelley. Ravina.
If Shelley would like to go first, that's fine.
Okay, Shelley.
Thank you, Ravina. I just want to reiterate that gender-based violence in the camps surrounding Goma has been an issue for a long time. And when people have been multiply displaced from their homes and they've lost their incomes, food, and they have to go in search of firewood for cooking. They look to survival techniques. They look to survival sex. They look to see how do I feed my children? How do I get food in front of my kids? So to sit here today and say who is responsible, that's not for me to comment on, but I do want to reiterate that this is a protection crisis of huge proportions. And the longer people can't get food, they can't get clean water, they can't get to hospitals, they can't get what they need to survive, that is going to be a problem. Thank you.
Thank you. I see WHO, Dr. Marchang.
Yes, thank you. Thank you. And I concur with the comments from the health side. We have seen largely increases in cases of SGBV at health facilities in the camps around Goma, and we have scaled up the clinical and medical capacity to treat them, in addition to take care of the incredible trauma and stress that women especially go through this, as women have been more affected by this type of violence, at least in these conditions around Goma. Some women have been raped several times in their search for firewood or just going outside of the perimeters of the camps. We also receive new reports that there is an increase in rape along the pathways that some of the conflict partners are now taking into South Kivu, and we're very vigilant to be ready and have some solutions to follow the populations as they move, as we have to adapt to the moving nature, if you will, of the displaced, and to see to attend to their health needs where they are, including through mobile teams and mobile clinics. Back over to you.
Ravina?
Thank you, colleagues. Just to add to exactly what colleagues have said, even before this current escalation, there has been grave sexual violence taking place in the DRC. When the High Commissioner was in the DRC in April last year, and he visited camps for internally displaced people, including in Bulengo, he was told by women that they had to sell themselves in order to survive, and that they were subjected to sexual violence while they went out to get firewood to be able to take care of their families. We are already receiving reports as well of sexual violence during this current escalation. And it is important that there is a heightened risk of sexual violence against women in the DRC at the moment. And this needs to be taken very seriously. We are again calling on all parties to ensure that they ensure the protection of civilians, and in particular vulnerable communities, in particular women.
Thank you to all. And just on the second part of your question, Gunilla, I think we can't speculate on what's going to happen on funds to this country, that country. But on the issue of the Rwandan support, I would like to refer you to both the statement of the spokesperson of the Secretary General and especially the one on the Security Council, which are very clear on the need, on the call on the Rwanda Defense Forces to cease support to M23 and withdraw from the DRC territory.
So, just on the rape question, very quick follow-up there. When you then say that the reports of rape, do you then mean that from both sides? I just need to understand what you mean when you're saying you're getting reports about rape and you don't want to say who it is, but is it from both sides, or what do you mean?
Ravina?
It's so difficult to corroborate. As you know, reports of sexual violence are always difficult to document and corroborate. And in this climate, it's premature for us to be able to attribute responsibility. We are continuing to monitor, and we will update you as the information is corroborated.
Thank you, Christian Ulrich, German News Agency.
Thank you. Patrick touched on this already, but I wonder about the UN, the appeals to all the parties to restrain and respect international humanitarian law is one thing, but who is the UN actually talking to, and what is the response of those interlocutors? Thank you.
There are, I think, again, lots of information in what was said in these days. Basically, I think the one thing that USG Lacroix said yesterday very clearly was that we remain really strongly committed to supporting ongoing regional peace initiative and continue to engage with all relevant stakeholders to bring the parties back to the negotiation tables, which we are already doing. In this regard, he also said, we welcome the Eastern African Community announcement to hold the summit on the 28th of January, and we also look forward to the African Union Peace and Security Council session, which is scheduled for today. So we're really bringing together and using all our contacts and leveraging on all the counterparts' efforts to bring the warring party to the negotiating table again. And the SG, the Secretary General, reiterated the United Nations support to the Luanda process. That's what we have to come back to. Beza had a question.
Thank you, Alessandra. Good morning.
Good morning.
I just want to ask about a little detail to WHO about the cholera cases. There is a risk. Are there a risk of a spillover to the neighboring countries? Also, are there any efforts on vaccination? Thank you. And I also have a second question, but on a different topic to Jens, but I can wait on that.
Yes, please. Let's finish. There's quite a few questions online on DRC yet. Okay, so Doctor, can you take? Sorry, Beyza is our correspondent of the Turkish news agency, Anadolu Ansi. Sorry, I should have reintroduced you. Go ahead, Doctor.
Okay, thank you. And great question. Thank you for the question. Of course, absolutely, there is a heightened risk for spillover of cholera into neighboring countries, neighboring provinces within DRC. We have seen this before. In terms of vaccination, we have had one of the largest vaccination campaigns, OCV